advocating is a boundary. Like, and people maybe would not look at it like that, but it is. It's saying, I'm going to ask questions and I'm going to make it a point to understand everything that's happened with my baby. And that is my right.
This is NICU Babies Parent Support with Kathryn Whitaker, a podcast from Hand to Hold, a national nonprofit that provides free personalized support, resources, and community before, during, and after a NICU stay. My conversations here focus on education and personal stories with medical and hospital professionals, counselors, therapists, and NICU moms and dads from across the country. So whether you're preparing for a NICU stay, you're currently there, or you're months and years past your stay, you belong here. The NICU is hard. We're here to help. I'm your host, Kathryn Whitaker, the mom of 6 children, including my very own NICU baby, and I'm so grateful that you're here. Well, howdy, everybody. Welcome back to the podcast. We are continuing our season of tending the home, the heart, and the body. And I know that we began with this tending of the home and tending of the medical records, which in and of itself can feel like a big beast. And I hope that those episodes gave you some good, practical things that you can do right now today to make your life a little bit less chaotic. And then we moved into this really tender part of the season where we had caregivers share their most difficult day in a really beautiful and vulnerable way and how they made it to the other side. I hope that gave you some hope. I was incredibly touched by what they had to share and how it affected me. And then as we move into this sort of final last few episodes of the podcast for this particular season, I felt like it was important to have someone who could speak to both sides of the table. This experience of being a NICU caregiver, a NICU mom in this case, but also being in medicine and understanding what it was like to see NICU families from a medicine standpoint, a physician standpoint. And I found her. I think a lot of us find ourselves on this NICU roller coaster, right? Like one day you're totally slaying it. You're getting it done. You're at the top of the roller coaster. The specialists have answered all the questions, you were dealing with the diagnoses, and you were getting it together. And many more days, you may find yourself at the bottom of that roller coaster in a dark corner with a box of Kleenex, wondering how this is your life. And it's a constant, right? Like you never get to stay in one part of the roller coaster. Just when you master it, you go back down again, and then you come back up, and it feels like it's never going to end. Like you're just on the perpetual ride of the NICU roller coaster. And I think that my guest today is going to help you, one, feel seen, that what you are experiencing is normal, but also some tools and strategies for how you can put pause on the roller coaster, or how you can put in better boundaries or find better support, better human beings to go with you on this ride so that you can come out on the other side thriving and not just barely surviving. And that was my goal today in this particular episode, was to give you a guest that could give you great wisdom and encouragement. And I found her. So my guest today is Dr. Jess Daigle, or Dr. Jess. She's a board-certified pediatrician, a neonatal pediatric hospitalist, and the founder and CEO of Mom and Me, MD. She's the proud mother of 2 kids, both born prematurely, with one staying in the NICU for 5 weeks. She has a concierge medical practice in Atlanta, Georgia, that provides in-home and virtual care services to NICU babies and their families, with focus on education and support to make the transition home from the NICU easier and less overwhelming. Amen, sister. I'm so excited to talk to her. She also offers life coaching for NICU moms to help them balance life after the NICU and be the confident mom that they want to be. She's been featured on many podcasts and is the co-author with 46 other women physicians in Made for More, physician entrepreneurs practicing medicine and living life on their own terms. Dr. Daigle is passionate about patient care and experience and advocates for NICU and postpartum moms and their families. She believes that moms and their babies should thrive, not just survive, on their postpartum NICU journey and beyond. She lives in South Atlanta with her husband and 2 children, and I know that you are going to gain so much from our conversation. So with that, let's chat. Well, welcome back to the podcast, everyone. I'm so excited to have Dr. Jess Daigle here. She is an expert in a lot of things, but particularly in the NICU, and I know we have a lot to talk about. So Dr. Daigle, thanks for being here.
Thank you so much for having me. I'm so excited.
Well, you definitely have. I always ask this question because I think it gives people good context as to why you chose medicine. So I'm curious, why medicine? What led you into that path? And then what ultimately led you to have such a passion for NICU babies?
Well, actually, I grew up wanting to be a neonatologist, which is a pediatrician who specializes in taking care of sick babies right after birth. And so when I was younger, I always thought I would do something with kids. I was always very interested in how kids learn. And I ended up reading this book called The Long Dying of Baby Andrew. And it was written by this family, an autobiography of sorts, describing their story of their baby Andrew, who was born as a micro preemie, which is a baby less than 28 weeks. And their fight for like what they considered his dignity and his right to, at that time, they didn't have a lot of the same medical interventions that we have now. And they really thought that their baby was being used for like research instead of really being provided like care. And they wanted to be able to, have a voice and the say in the care, type of care he received. And I was very intrigued by this book. And I don't know why I was reading such a heavy book at like 10 years of age, but
I was getting ready to say, well, but sometimes, I mean, books can sometimes tap into something or give voice to
Yeah.
something that's already there and
Yeah.
open a new door. So it sounds like that was the
Yeah.
case.
Yeah. I think I remember going to the library. That's when people actually went to the library and got books.
Hey, I go to the library. I have a whole stack right over there.
And I think I was looking for things about babies, like just babies. I was very interested in that. And when I came across it, because it's a picture of a baby, a tiny baby on the front, I think I was just intrigued by it. The other piece that's important to that is my friend. His mom was a neonatologist, and she invited me to come to the hospital to do rounds with her, like to look and see what a NICU baby looked like, which now looking back was such a unique opportunity because now the NICU is so protected for good reason. But
Yeah.
you won't necessarily find like early learners in there.
Right.
Families are even trying to get their siblings to get in there and see like tiny NICU babies, right? But at that
Right.
time, I was able to do that. And I was just so in awe of like life before my eyes, like happening and watching them like grow and develop. And I was just in love. And I was like, this is what I want to do. So I went to this website called Neonatology on the Web, and it actually tells you what to do, like to become a neonatologist. It describes what it is and about how long you have to go to school and the training and everything. And so I set myself on that path. And I got into, medical school. I got into residency, and my intern year ended up having a miscarriage. And so then that was another pivotal moment because I started to realize, like, with all the work that we do, we never think about what our patients might be feeling or going through an experience like that. And then how you kind of become like the statistics that you tell people about, right?
Well, you don't know what people experienced before you
Yeah.
see them.
Yeah.
Sometimes we think that it's just birth, but you don't know maybe the hardship or the trauma
Yes.
that came before that.
That is so true. That's a good point. Because even now in my work, as I go, like today, I sat down, I went to a C-section this morning, and you're looking at gravida 3, para 1, and you're like, what happened with that other baby? It makes you
Right.
think about what all people had to do to get this one child or this second child. So that is so
Right.
true. And so because of my miscarriage, I ended up being considered high risk. And so I was seeing a maternal fetal medicine doctor, which is for listeners, so it's like a specialized OB that'll take care of people who may have issues in pregnancy or issues with the baby in the pregnancy. And so you get a little bit more like a one-on-one care, so to speak. You go more frequently to the doctor to more frequent OB appointments, I should say. And so I ended up having my son at 31 weeks. I was on bed rest with him 9 weeks in the hospital. So
Ooh,
before I even had him, I was in the hospital for 63 days.
that is
Oh
a
gosh,
long time
it
to
is a
be.
long time.
And without, I mean, some moms may be listening and they're like, my baby was in the NICU for 63 days, but you were still cooking a baby for
Yes, I
63
still
days.
was. I still
Ooh,
was. And when she had told me I needed to go on bed rest again, I flashed back to when she told me the same thing with my first pregnancy. And at the time I stayed home because I thought, okay, I just need to not be busy is what I, interpreted it as. So then after I had my miscarriage, I had gone to get something to eat earlier that day. Me and my husband at a restaurant, nothing that I thought was too strenuous. But you know how we do, like when things happen, we rationalize and we internalize and say it's because I did this that this happened. And most of the time it's not true. But because of that, I was like, okay, I'm gonna try to make a different decision and pray for a different outcome. So
Wow.
I was like, if I have to be in the hospital to make sure I'm really laid up and being monitored, that's what I do. So he came at 31 weeks and like one day, and he did require a little bit of surfactant, which a lot of NICU moms may be aware of that, but it's a substance we can give babies to help their lungs breathe better. And so he got that. And then he was on room air for that whole time, the rest of the time. And he was just basically considered like a feeder grower.
Feeder grower.
And
Yeah, we all like to
yeah.
have feeder growers. They're
Yes. That's when you know you're close to going home. And he required treatment for jaundice, the yellow color of the skin that babies get when the livers are immature. And so all of that kind of informed like the work that I do now. So I already was interested, and I had actually gotten into fellowship, and but it was the delay because of the bed rest and then him being the NICU, and then trying to have a little bit of time before I went back to training, which I feel rushed. And so interesting now, I see a lot of people fighting for more paid maternal leave, which will help a lot of families, especially NICU families, because they definitely have an extended postpartum.
No, we just had a podcast episode specifically about advocating for paid parental leave. It's such a huge topic. But
It
okay,
is.
so you're doing all this NICU stuff while also pursuing a career in medicine. That
Yes.
feels like maximum stress.
Yes. I don't think I did at the time. And I speak about it, a lot of it now, looking back, that I didn't give myself grace and compassion. I had so much expectations of myself on this journey. And I think I didn't give myself grace because I knew like what to expect in the sense of I knew what having a NICU baby meant, what that looked like in terms of I knew I was going to be having to visit him and feedings and the nurses. And I knew all the lingo, right? Like I didn't have to go through that part.
Do you think that you didn't give yourself enough grace because you were like, well, I should know what I'm doing because I'm already in medicine? Like somehow I should be above all of this and like be superhuman. Is that what you were?
I think so. I think I
Yeah.
just kept plowing on. I think I was like, so I know what to expect. So let me just get with it. You know what I mean? Like,
Just get on with it. Yeah.
yeah. And it was not like that. Like when my son came home, he ended up having to go back to on a feeding tube. And that really rocked my world. Cause then I was like, did I not pay attention? Were we rushing him to come home too soon? And then I was trying to balance teaching other people to feed him with the pump while I was going to work. I remember getting a 911 call one time while I was on rounds that my
Oh,
sitter had to call 911 because my son had choked and had turned
oh my
blue.
gosh.
And I was like, oh my God, like I got to go run home to see about my baby. And I just remember just feeling so conflicted. It was affecting like my time management. And I just feel like my world was just like, I just was like crawling up like those rocks. Like when, you're crumbling, you're just trying to like hold on to
Mhm.
something. That's just kind of how I felt. And so I had gotten into fellowship and I was delayed. So I was still trying to plow on like, okay, I'm just going to keep going. But then it really was affecting the way that I was showing up, even as a fellow, and not in the clinical sense. Like I still was loving the work. I really love taking care of NICU families. That part has never changed, which I'm grateful for. Because sometimes when you can go through an experience like that, which now I recognize was traumatic, people want to step away from it. They don't want anything to do with the NICU. They don't want to talk about it. I'm grateful that that was not the way I felt about it. It actually made me want to be more involved and be more of a voice for families because I realized so much focus is on the baby, which is a part that's not so different, even when you don't have a preemie baby, right? You see a lot of families that feel like the mom is overlooked and the family's overlooked when they have this new baby. Everybody's focus is on the baby. And it's like, wait, there is a parent birth out of
What
this
about the
journey
lady that
too.
gave birth to the baby?
Yeah,
Let's not forget
yeah.
about her.
The birth of a mother and a family and all the changes that come with it.
Yes.
And so it's such a layered experience. And I'm so grateful that I had it in the sense that I can give a voice to the work that I was already so passionate about. But like you said, it was just something in me that already wanted to be an advocate for these babies. And now I have the personal experience to layer onto it, which I've had families tell me that it gives them more hope and they feel more understood knowing that as a professional in the NICU that I went through it too. And I'm not just saying empty words like, oh, it'll be okay. Like when people tell you that,
Right.
like, do you know it'll be okay?
But even if you do say it's gonna be okay, they know that you come from a place of understanding, and they
Yes.
feel seen. And I think
Yes.
I think every person, regardless of the experience, wants to be seen. But I
I
think particularly
agree.
when you're in a high risk highly emotional, really stressful place to have the person that you're trusting with the medical care of your baby to actually see who you are and to see what you're
Yes.
going through. I mean, the trust there is really good. I mean, I know that that's really led to what you do now. So I'm really
Yes.
curious why. I mean, we know a little bit of your why, but why this particular path for the
Yeah.
mom and me? And then what did you hope to provide for families that you
Yeah.
weren't already doing in medicine?
Yeah. So the mom and me came out of, well, even the mom and then me, that title even is birthed out of the fact that after my own journey, I realized like the baby does as well as like the mom and family. Like I don't mean to exclude like a dad and partners
Sure.
and things like that, but it's really understanding that this mom birthed this baby. And so the care of this works when we also focus on supporting them so they can continue to support this baby that they've had, right? And
Yeah.
so being in the hospital, I see newborn babies. So I work as a NICU hospitalist and a nursery pediatrician. So I see babies born every day. I take care of them if they have to go to the level 2 NICU. And so talking with families, I would hear about their stories and their concerns. And I realized, like, when I would be outpatient, because sometimes I was still mixing some clinic work, I realized when these families would come in, it's just such a rushed process. It's like, okay, you had this baby, and okay, they were in the NICU, and then it's like they had no space to process with their own new doctor, like, this is what has happened, this is what I'm concerned about. Like there's no space and time created for the fact that this was a different experience than just, oh, I went and had a baby and came home in 2 days, you know? And so I wanted to be able to provide a place, one, from just that I already just love taking care of that population, but also understanding that this support is crucial to these babies doing well. You see a lot of these families being readmitted for failure to thrive, and
Yeah.
because the formulas wasn't mixed right, or they just didn't understand how they needed to feed the baby, or even that they could advocate that they were concerned that something wasn't going right with feeding because they don't want to look like they didn't understand maybe what the NICU said about how to feed the baby, or what was really how it was being mixed, or just everything that these families have to deal with. They're having to run to see different specialists. Like, you got to see the lung doctor, the heart doctor, they got to see an eye doctor, every organ that the baby has. Just about
Yeah.
somebody need to talk to them about it, you know, and that is a lot. Like, because the family had all of that right there, essentially, just about. And so now they're having to manage, like, not just themselves and their own healing postpartum and their own household and maybe even other kids. Now they have a child that needs a little bit more extra attention outside the NICU. And sometimes I think we give this false, like, sense that, okay, we just got to get the baby home. And I thought that same thing, and realizing, like,
Yeah, everybody's charging towards discharge. Like, you're like, once
yeah,
we get to discharge, it's a
yeah,
piece of cake. And then I was
yeah,
like, someone needed to tell me that that's when it got hard.
yeah. Yes, it's true. And we're doing families a disservice to say, like, and I spoke on this at the Hands and Hold conference that I did last what was that, November? I think it was November, October
Yeah,
last
November.
year.
Yeah.
But that we really need to do a needs assessments of families. Like, what does it really look like for them when they're leaving the unit and going home? What does their life look like? And how can we help them optimize their support and their understanding of what it's going to take when they leave the hospital? And I don't think we do a good job of that. And I just had a OB that I talked with who had a baby now. And she's an OB. She delivers these babies all the time. And she felt unprepared. Like, she felt like even the 5 weeks she was there and it was time to go home, like, wait, what? And then she's gotten home and they didn't tell me about what, like, the schedule, or like sleeping and all these things like that might be difficult or different in my baby. And how might I need to take care of this NICU baby differently than I would have if my baby would have been born term and came home right away. So all of these things factor into what I do, the work I do with my family. So, like, when I meet with them, I do all the technical stuff. Like, yeah, we're going to weigh the baby. We're going to grow, look at the growth. But I asked the family, how have you been since you've left the NICU? How was that experience for you? Because they may not have even had a chance to, like, vent even. Like, well, I didn't really like, sometimes the nurses did this, or I didn't like that the doctor did this, or the therapist said this, or, they don't, who is there to listen to them in this space. And there are therapists and counselors, but a lot of times the focus is not on the help that they need. They're worried about their baby, right? Rightfully so. And so I provide that. Like I have check-ins with them, and not just the baby, but how are you doing? How is this affecting your relationship? How are you guys navigating that? Sharing responsibilities and duties with this baby. It's just so much, and it's doable. You just have to say, okay, what is it that we need to get done? And let's have some strategy and some tools to like map it out for ourselves. And that includes setting boundaries and having shared responsibility and knowing who to call when you need help. And I want to be one of those people that they can call.
So 2 questions. So is it only if people live in Atlanta, or do you do it virtual? And then the second part of that is I want you to give people an example of like one practical way that maybe like what piece of information might you impart to a family that they may come back and be like, I'm so glad that you told me that. So let's start
Okay.
with
Yeah.
the virtual in-person part and then go to that.
So the in-person, if they want like the care in terms of like me coming to like actually be able to see the baby and weigh the baby and things like that, that part is local to Atlanta. But I do offer like virtual help if they have questions about their baby, if there's concerns, things that they feel they need to understand. Like I had one mom who was really upset that her baby needed a PIC line, which for listeners is like a specialized kind of IV that can go a little bit deeper, so you can give medicines, drugs, things that are a little bit heavier through venously that would harm like the peripheral IVs in the babies, like the ones in the hand. Some things can't go through those IVs. And so she was afraid of that. And, without being there, I don't know what was the explanation but one of the things I do is get to the root of, okay, so tell me when they said that, what did you think or feel? What is it? What do you think that means about you or your baby? You have to get to the root of what the objection is, because she's not just a mom trying to be difficult. And we do that in medicine. We are very bad at labeling people if they don't just do what we want, right? Like they just being difficult. But why? Like there's a
Yeah.
reason. Like it's not, but people don't just wake up and say, I'm just going to refuse the PIC line today.
Well,
Like,
and as I was visiting with a nurse the other day, she said, like, we're seeing people on their worst, many of them on their worst day or in their worst moment. So she said, I
yes,
have to remind my nurses, give people grace.
yes,
I was not at my best in the NICU. I was a little bit mama bear.
yeah.
And I'm sure it said in the chart, mom in 302 is very protective. But I'm okay with that. But I think sometimes people fear like if I ask that question or if I push for that thing, am I going to be labeled and is my baby's care going to be affected?
Yes, they are. I'm in a group with other NICU moms, like on Facebook, like Thousand Moms, and they do say that whenever they express that, and I say, "Hey, this is a way to approach that," like a way. They're like, "Well, I'm afraid." I had a doctor tell me that she was afraid of pushing back because she was worried that they were going to start treating her baby differently, and this is a very real fear. And it's unfortunate and sad that there would be an environment created in a way that people wouldn't even feel like comfortable being able to talk to their nurses and doctors. And so I really do a lot of empowering people to do that. And I say there's a way to do it where you're being respectful, but there are a lot of cultures in medicine, and there's a lot of bias and a lot of things that, and I'm actually going to be speaking on that at the National Association of Neonatal Nurses Conference
Good.
in September this year. I'm talking about communication and bias and its impact in the NICU. And so it's so important. But to answer your question, I do virtually do that. And that's part of the thing is I actually allow them that space to also vent about what the experience has been like for them. And then we get to the heart of what is their real concern at that moment? Is this something that makes sense? Or this is why they might be doing that? And so then she felt more comfortable, I was able to go and be like, okay, yes, I'm okay with that, because she had more explanation. And one of the things I've come to understand is that I don't take for granted that everybody takes the time. Like I went into medicine assuming like everybody wants to do no harm and everybody's great and happy to do this work. And unfortunately, it's not true. And it breaks my heart, but it's not true. Some people are very, very privileged about medicine. Like, because I'm this, you should listen to me. And it's like, we have an opportunity as doctors and nurses, therapists and people to be a part of such a special and frightening moment in someone's life, and they will remember you forever. However, you're forever cemented as part of their experience. Like they can never not see you and be like, not associate you with their NICU baby. And so why not create a moment where to say, you know what, this person made me feel empowered in my experience. They made me feel seen and heard. They were that shoulder I can lean on. And in my talk in September, what I want the nurses to walk away from, kind of like what that nurse showed you, is that the next day that they go to scrub in and the next day the doctor goes to round on the patient, to remind themselves, while this may be the 1,000th NICU baby you have seen, this may be their very first experience. And you have to lead with that. And you have to tell yourself that every day. It has to be intentional. And so I do have the virtual and the in-home. I'm actually thinking about creating a NICU membership as well, where it's a space where they could come and we can have like bi-weekly like roundtables if they have concerns, if they want to share with each other about different things, just to create like a private community at home for families going through it. Because I think you need help at every stage, not just when you're in it, but even once you leave the NICU.
This podcast is produced by Hand to Hold, a national nonprofit, but we're more than simply a podcast. Be sure to download our app in the Apple Store or on Google Play, or you can visit our website to discover all the ways that we can support you as a NICU parent at handtohold.org. You can join one of our support groups, sign up for counseling, find loss and bereavement support, request a peer mentor, or check out our educational resources and family stories. And all of that is at no cost to you.
And so to your point, for a family who may be listening now at this very moment, and they're just like, Dr. Jess, it all sounds great what you're saying, but I'm afraid still. I have two pieces of advice. The first is have a journal and document things. And don't worry about anybody worrying about what you're writing down, because this is your baby and you have to, like you said, Mama Bear, you have to be protective. We should be championing the families that want to learn and be involved and ask questions, right? So write down the diagnosis, the words, because when you're in the NICU, it's a new language. It's like learning a new language. So write these terms down, ask for literature, even if you have to put it away because you can't look at it right then and there. Just have your little folder and say, this is information about my baby. And eventually you will be able to look at it. Take pictures, because eventually you will look back at them and you'll wish that you had pictures of that moment to look at how far you've come. But journal and document for the sake of understanding and being able to ask questions. And that'll also help you feel prepared for discharge, because you would have been following the journey along the way. And you can say, well, they were being treated for this, for respiratory distress syndrome, but now they came off oxygen on this day. And these were the medicines associated with that. Okay, they had a PDA, patent ductus arteriosus. This is what they had to do for that. This is what they said we need to do for that. This is the specialist. If you keep yourself organized along the way, and even if you can't do it like right at first, but like once they get to that feeder grower stage and they're like, okay, we're about to start letting baby eat, go ahead and sit down one weekend and write a quick summary for yourself. And then all along the way, ask questions. Even if you have to say, hey, what does this look like for me? Talk to whatever pediatrician you think you're going to want to go take your baby to and say, hey, they're saying my baby is going to be coming home. What is your comfort level taking care of a preemie? Do you have some strategies or ways that, I can help you with this information? Because sometimes, depending on the hospital system, they may not have access to your records right away. Some NICUs are doing a very, very good job of sending people home with nice little booklets of information. Some of them, you're going to get a stack of staple papers.
Yeah, I just had to request medical records from our hospital, and I was like, yeah, things have come a long way.
Yes, they have. And so just really, if you start with this is my baby that I'm responsible for, these are people that are caring for my baby, but he's still my baby. That thought empowers you to say, what would I do for my baby because this is my baby. What do I feel my baby needs? What do I need to understand about taking care of my baby? In that sense, it's the same as if a mom came home with a baby right away. What does my baby need? I still have to learn this baby. So learn your baby even while you're in the NICU.
What's a good boundary that, like, if a mom is trying to, or a dad too, I want to use this, for the caretakers.
Yes.
What's a good boundary to put in place to protect like your emotional well-being while also taking care of your baby? Like what would be something that, speaking from experience, but also speaking from the medicine side, what's something that a caregiver can do to protect that piece?
You're in my phone. I actually have a post that I'm
Really?
about to post talking about
Oh
boundaries.
my gosh.
Yes. That is funny. I'm like, you've been peeking in my phone.
I have. You didn't know that. Yeah.
So what a boundary. Okay, so one, I think is first I want to address a belief. You have to believe that that boundaries are okay and important
Mhm.
because sometimes people are at the expense, they think they have to be at the expense of everybody else because they know more. Like, oh, well, they have kids already. And so I should listen to them. Or,
Mhm.
they're the doctor. The boundary is you have a right to understand everything that's going on with your baby and speak on it and agree to it or ask for more information. Outside of like, if they're doing something to emergently save your baby, I think most people would be like, well, I mean, I know
Sure.
that needed to be
Yeah.
done. But if it's like, well, we need to do this, lumbar puncture. Okay, well, then tell me what are we going to be getting from it? And what is the risk? Be okay answering questions. So I think that boundary for me is advocating is a boundary. Like, and people maybe would not look at it like that, but it is. It's saying, I'm going to ask questions and I'm going to make it a point to understand everything that's happened with my baby. And that is my right. And that's okay. And then that leads to your peace because one of the things that I see people do is some moms have regret. They have regret.
Yeah.
I didn't ask enough questions. I didn't, I didn't really like when this nurse said this or did this. And I wanted to speak up on it. So sometimes people confuse speaking up with, you don't have to be aggressive. You can say,
Right.
hi, Sally, I would like to talk with you. Yesterday, like, for example, when my son was in the NICU, the ones out there now, y'all have a lot more than we had back in 2013. I had to go to Marshall's and find this little preemie little outfit. It was blue. I still have it because, you keep those things.
You
And
do.
I brought it to the NICU. And, it was his first time he could wear clothes. It was where the wires could still be where they needed to be, all the things that you have to worry about when you're trying to dress your baby for the first time in the NICU. And so I go to come the next day and it's off to the side with this poop stain in it. And I was like, what in the world? And I talked to the nurse. I said, what happened? She's like, oh, I pooped. And I said, and you didn't think it would be okay to like rinse out the stain, like just to rinse it? And so somebody else might have been like, oh, no, I would not have said that. But I was very respectful about it. Like, I was like, I would have appreciated you doing this because this was like his first outfit. And now it informs when I see I run these babies, I change their diapers. If their outfits are dirty, I rinse them in the nearby sink and lay them out to dry
Experience. Experience. Yeah.
because I know this mom is more than just, oh, it's a piece of
It's not just an
clothing.
outfit. It's not
Yeah, it's
just an
not just an
outfit.
outfit. This is a
It's your it's
symbol.
your it's your one tether to normalcy.
Yes. Yes. It was the one thing that was like, yes, I love that. My one tether to normalcy, like being able to clothe your baby, something that people just don't think is like such a monumental thing, but it is. It is. It
Yes.
was like the one choice I had of thing I could be as a mother outside of just feeding him. I was bringing my breast milk. I was doing that. I felt empowered there. But that was
You're
like
gonna
that
make me
moment. That
tear
was
up.
my moment.
I'm thinking about that first outfit and how like what a monumental moment that
It
was.
is. It
It's a huge
is.
one. You're not supposed to make me cry. What are you doing? You're not supposed to do that.
I'm telling you, crying is good for the soul.
Amen, sister. It is. I love this idea. By the way, whenever you write that article, please send it to me so we can link to it in the show notes.
Okay.
What do you think the biggest gap is in caring for caregivers in a hospital setting? Like where do you think that we're failing our NICU families and how can we do better?
I think it's like a needs assessment. And like, so one, I think a lot of families have to understand too that even though there are different levels, so there's different levels of NICU care. One is like nursery basic, the baby's gonna transition pretty quickly. Then there's 2, 3, and 4, and it escalates according to age of baby. So any baby younger than 32 weeks has to be in a level 3/4. Level 4 tends to be like surgicals. So there's also different levels of support throughout that, right? Like, so more of the level 3 and 4s have the therapists and the social workers that are more specially trained. And so I would be interested, that would be a fantastic study to see if there are differences in readiness and support based on availability of these professionals in the units. And so since I work more in level 2, this is just usually the hospital social worker, which I think hospitals need to do better about that, because I think areas like NICUs and OB and labor delivery need their own designated NICU. Like they don't need, their own designated social worker. They don't need to be running from like 3 West where they saw the family of the 65-year-old who's, and then they trying to come over here to talk to this mom who's just had a 21-weeker. Like we need our own specialized people in that area, because it's a different type of mindset they even need to have. They even need to be viewing when they show up for this family. What does that mean? What does that look like? Right. And so I think that for families needs assessment, like, okay, not just all the demographic. Okay, who's your name? You have some other kids, blah, blah, blah. But what does that mean where she lives? Does she have other kids? Her job? What is her plan? Like, is she going to be able to go back to work? Does she have the means to stay home? Does she have to go right back to work in like 3 weeks after having this baby or whatever? Like, all of this matters, because then you can say, okay, well, how can we support you? Where are you struggling? I did a post about, let's help her, because I don't know if you on Instagram, they've been having these like one NICU family help another NICU family, or like if you're in this situation now or used to be, help somebody who's in it now or before, give advice, take advice, that kind of thing. So I did it for the families. I said, let's help our friends and families. What is one thing you needed from your friend and family when you were in the NICU? Because there's this idea that people think, I think is one of those things, like people think people don't want to be bothered, and then so they don't do anything. And then you have the NICU family that don't want to bother anybody, so they don't say anything. And then you have this divide where nobody's getting help or helping because everybody's worried about, like, it's like when people are grieving, right? Like a funeral, like, I don't want to say the wrong thing. And then they do nothing. And that's not the answer either. You say, I don't know what to say in this moment. Just be honest. But I'm here to help you. I want to help you. What is something you need? Because families still need practical things like food. They need food too. Gas card. They might be driving 2 hours away to go see their baby. Hey, you know what? I can't do much, but hey, I can keep your kids for the weekend while you go spend the weekend with your NICU baby. Maybe I can create a slumber party with your kids and my kid, and you can go see your NICU baby. Like, just get creative about relieving the stress, but recognizing that there is stress. And sometimes they can't, like, people don't understand, like, your mind, when you have had this experience, is filled with so many emotions. Like, it's just enough that you get up every day and like show up, like, instead of like curling over in a ball in the corner, because that is how you feel, and depending on the degree of what your baby is going through, every time the phone rings, these families are scared. Like, is this somebody calling to tell me that my baby has died today? Or they need another procedure, or, well, we thought they were going to be coming home, but actually they failed their car seat test. And so now we got to watch them. And people just don't realize all the things that are coming at these families. And that's fine in the sense that I don't want everybody to have a NICU baby to have this, to get this understanding.
Right. We don't wish it on anybody.
Yeah. You don't have to have been through it to get it, but you can say, I have had a hard experience. I know what getting bad news feels like. I know what having a failed expectation feels like. Channel that. What does that feel like for you? That's probably what they feel like 10 times. And so then what would you need? You need a listening ear, somebody to validate, somebody to say, I may not have had that experience, but I can do this for you. That's the ways that we can show up for the family. And it starts in the hospital, like creating opportunities for families to talk, or an organization like Hand to Hold, making awareness. I didn't even know that you guys were, I learned about you guys from a family. In the group I'm in on Facebook, I asked, like, I think I posted a post, like, what are some things that supported you? And I think somebody mentioned that. So again, even though the NICU is its own community, there are even silos inside of that. And I think we just need to break open more information sharing of, like, these are the ways I got through it. And that might, I'm in this state, This is what helped me. Well, okay, I'm in Nevada. These are the programs available. Like, we really need like state specific information. I always said I need to create this on my website, but these are the programs and communities and things that you can access if your baby is in this community. That's what we
There's your
need.
next job. I'm just trying to give you more jobs. So
Okay,
there's your,
I'm gonna have to do it. I'm gonna have to get a VA and we just get on it.
I mean, you can do just about anything in the world that you want as long as you have a VA and the internet, right?
That's true.
I have one last question for you,
Oh,
and I think we talked a little bit about this disparity of care, and I know, and this implicit bias sometimes that we
yeah,
have in medicine, but also with families and what they have access to and what they don't have access to. Dr. Daigle, I'm curious what it is that you do, or I guess maybe where your passion comes from as to why you try to address that disparity, because I know that sometimes privilege opens doors for you and gets you the help that you need, and sometimes it closes a door. So
it
I'm
does.
curious what it is specifically that you do to help
Yeah,
those families who don't have that access
yeah,
or don't have those resources, and that you reach out to them and try to get them plugged into the things
yeah.
that they can use and help to manage a really difficult place.
Yeah. So one of the things is me, like, I think we as providers should take on learning a little bit more about what is available. So I just started like Googling like what is available. Like even the early, even on my link that I sent you at the top, I have early childhood intervention for your state because that was one assumption. I think the problem is we make so many assumptions instead
Yeah.
of asking questions. Don't assume, ask questions, get curious about, because I think that is the one powerful thing that I do. And that informs and affects the care that I provide is that I'm curious about my families. So I ask questions and I tell them it's so I can learn how to help them. And people know in what spirit you're coming. They know like if you're trying to help them or if you have some other agenda, it comes through, it shows through. But like one family it was a mom. She was like, I had these, 3-month corrected, 27-week twins. And, when they're on tummy time, they still can't raise their head. And my pediatrician told me just keep doing tummy time. I was so appalled. I was like, oh my God, no, 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 no. That is not the right answer. You need physical therapy. I said, what state are you in? And so then I went to her state. I sent her the information about early childhood. Nobody had even.
Oh my gosh.
The other things where we fail families is we don't follow up. So we're
Mhm.
really good in medicine and checking boxes. Check. I gave them a piece of paper. My work is done. No, it's not. Do you know if they understood what you said? Can you have them repeat? Okay, you're going to show up on this day and for this appointment, or your pediatrician is going to give this referral, and these group of people are going to contact you. I empower my families. Look, I sent this referral. If you don't have a phone call in 4 days, you call back and say they haven't called me yet, so we can see because a couple things could have happened. The facts could have not gone through. They could be overloaded, whatever. I mean, people, where there are people, there's room for error. Don't make no assumptions that it doesn't mean that it was done out of a bad place. People drop the ball all the time. People are always trying to multitask and do 8 things at the same time. And so what if they, got to the 7th person and left off that last referral for some reason, or even if it's just a phone call.
I wish that doctors sometimes call, like when a patient didn't show up, if they called and asked why. Was
Yeah.
it a transportation issue? Was it a
Yes.
childcare issue?
Yep.
Because sometimes we assume that they don't care about their baby,
Nope.
and that is rarely the
It
case.
is rarely the case. It is rarely the case. I see it all the time in the hospital. Like whenever mom comes and they're like, oh, this mom hasn't showed up all day. Like in the NICU, they would say that. Sometimes the nurses make comments. And I'm like, did you ask
Why?
her what's happening? Oh, okay. She has 4 of the kids, and you can make your judgments about all that, whatever, because people like to do that too. Oh,
They
well, they
do.
shouldn't be having all these kids if they know they couldn't take care of them. All these comments, I hear all of it. The thing is, everybody done been at some place where they probably thought, this probably wasn't the best idea for me at the moment or best timing or whatever. Everybody has been there. And yes, and we know what we deal with it, but that's not our place to judge. It's our place to support because the fact is, she still needs the support. This baby still needs the connection with his mother. We need to figure out how can we help her do that. I sometimes I done gave the strategist like, hey, was there somebody that can maybe just keep the kids and you can just come on Fridays, even if Fridays is your day, like you make some kind of plan. But by you shutting your eyes, you don't explore opportunity and even get them thinking. Because again, they're already under the weight of the guilt. You don't think they don't not feel guilty for not coming to see their baby, that they're not thinking about that they're not frustrated. They might already be judging themselves. They don't need you to come and be like, well, you just shouldn't have had all those kids. I mean, come on. So no, like let's give some strategy and some opportunity, or let's say, hey, well, I've had FaceTime families on my own phone and be like, hey, here's your baby. You want to see what he's doing right now? Oh, look, he's trying to throw the pacifier at me, and we laugh, and but that moment helps them like feel connected to their baby and just see something like. And so I love those units that have the cameras and the things that they're moving for, because again, a lot of these families are an experience that they were not expecting to have. She fully expected to have a term baby that she could just probably have at home with all the other 4 kids, to be honest. So she obviously has skills that she used, but this is a different experience and a different ball game. And so we just really need to do better at asking questions. And that's where, again, that needs assessment. And even if you don't have a social worker, but even if in part of the intake, like, what is your situation? What are might be some barriers for you coming to see your baby, or understanding? And then you may not be able to do whatever it is every day, or maybe you can do it weekly or something, but there is opportunity there. And we shut the door as if we can't do all, we can't do anything. And that's not true. You can do something. Sometimes it's the little small things. It's being willing to take, like, I've called families myself and say, hey, let me give you an update about your baby, because we have to have more of a team approach, even in the unit. The nurses are busy. Yes, doctors were busy, but sometimes we're not as busy. I mean, don't fuss at me, doctors who are listening. Like, what's she talking about?
No, I could literally ask you a million more questions, which what that really means is that I need to have you back. So
Yes.
I know that you have been up all night. So thank you for this gift of like knowing and making people feel seen from knowing from a place of experience, but also being in a position where you can advocate for changing. You are doing good things. I love that. We'll link all of that in the show notes, but thanks
Okay.
for coming on. It was awesome. So the reality is that I could have talked to Dr. Daigle for a significantly longer amount of time than we did, but I had to cut it off somewhere. As I told her at the end of the interview, this just means that I'm going to have her back. So in today's 2-minute take, my big takeaways were actually a few things that we said towards the end. One was be curious. And that goes for the caregivers that are listening to this, so the moms and dads who have the NICU babies, but also for the medical specialist on the other side, that we should both be curious about one another. I'm asking, as a NICU mom, I'm asking my doctor, I'm curious as to why we are pursuing or why you are recommending this particular course. I want to understand why, so that I'm at peace with wherever we go. And then from the medical profession side, I'm trying to understand why maybe it feels like there might be a barrier. Or it feels like you may not be on board. Like, why is that? What reservations do you have? What questions can I answer? How can we maybe pause and learn from one another? I think there's a quote, be curious, not judgmental. And so I think this ability to remind ourselves daily to be curious. And then also, I think that her advice of keeping a journal, whether it's on your phone or whether it's a written journal, no one else has to read that. But I think this perspective that your job is to learn your baby, that yes, you're processing how you're feeling, maybe some of the hard things that you're confronting, and maybe trauma that you're going to have to deal with later, but also this great opportunity that you have to learn your baby. How do they eat? How do they respond to pain? How can you comfort them? How can you help them thrive and be the best sweet little baby that they can be, that God willing, they're going to grow up to be a tween and a teen and maybe a young adult. So I think this desire to learn our baby, instead of wishing maybe for a different baby, but instead, what is it that my baby can do? And how can I help them as their caregiver, as their mom or dad, help them be the very best that they can be? To me, that's really exciting. And I think that really came through. I think, it just felt good. For me personally, it felt good to be seen in this conversation. Dr. Daigle, she made me tear up. That doesn't always happen. And I felt seen. I hope that you felt seen too. We have so many more great episodes coming, so don't go anywhere. Make sure that you're rating us on Spotify and over on Apple Podcasts or wherever you listen to podcasts. That definitely helps more people hear what we have to say. And then over on YouTube, you can always watch us. We love having you over there. So make sure that you do that. But don't go anywhere, because the next time you hear us, this is what you're going to hear.
It's a very vulnerable time where there's nothing you can do during that moment of delivery, and you just hope and pray that everything goes right. And then, all of a sudden you're thrusted into this medical world where I didn't have a background in healthcare or medical or anything like that. And you're just being thrown all these words, and doctors are trying to explain things, and then you're trying to relate it back to other folks. And it's an overwhelming time.